someone under the age of 15 was 5 times more likely to die of pregnancy as someone over the age of 20. Now, fortunately, there are few pregnancies under the age of 15, but this is a very disturbing statistic. One thing I want parity. Women have to be on par with men in every way, including the age at marriage. Well, maternal mortality is, for me, an index of civilization. When we look after pregnancies in adolescents, and again now today, the reality is when we look after pregnancies in the very elderly, there will be certain maternal risks. Very often the young person, the adolescent who's pregnant, has a very, very low level of self-determination, autonomy and care. And that probably puts her at risk. So there was a very interesting WHO document a few years ago on adolescent pregnancies. And they said that a person who was pregnant under the age of 20 was twice as likely to die of pregnancy as someone over the age of 20. Now that says a lot. Why does this happen? Well, for the very young, it is because they are not ready physically, physiologically for a pregnancy. But for the older adolescent, when their physical characteristics may be the same as, say, someone who's just over 20, the lack of autonomy, the lack of care, the lack of the kind of proper medical interventions will put them at risk. Now, in this, I specifically want to mention the very young, the ones under the age of 15. And that same document said that someone under the age of 15 was 5 times more likely to die of pregnancy as someone over the age of 20. Now, fortunately, there are few pregnancies under the age of 15, but this is a very disturbing statistic. I believe that people have a right to choice and people have a right to decide. And I have patients of mine who will have pregnancies into their late 40s and sometimes 50 and early 50s. I don't think we have any right to talk about their decision so long as they're not putting themselves at risk. And when I was asked about this woman in her 70s, my response was that the first dictum in medicine is first do no harm. And there's no way that very elderly woman, so we have to have a cutoff because that very elderly woman is at tremendous risk when she goes through what a pregnancy does to her body. So first, let me put on my obstetrician's coat on and talk about the medical factor. The commonest cause of maternal mortality still is hemorrhage or bleeding after she delivers, something called as postpartum hemorrhage. And this is impacted by many things, her health, her nutrition, and in our country, if there is one cross-cutting problem we have across many diseases, illnesses in pregnancy, that's the condition of anemia. That's a low hemoglobin. When your nutrition is low and your blood does not have enough hemoglobin, you are less able to tolerate what would happen if you bled more than normal after delivery. Secondly, we do not have an adequate support system when it comes to blood banks and blood products. This is the first thing a civilized society does. It has to be available easily everywhere. And we as a society also bear a responsibility because unless someone is donating blood, how are we going to save lives? The third is in these situations, there's something called as the golden hour, where you need to do things really soon. So better training, better facilities, better everything. The second important cause of mortality is infections, which boils down to hygiene and cleanliness. The third cause is abortions and miscarriages. And India has done great with maternal mortality to date, but we've got a lot more to achieve because now we will have to work with difficult medical diseases and disorders, hypertension, liver disorders, all kinds of things which initially we thought only happened in the West. If you're looking at the biology and the medical aspects and the safety, I think when you get past adolescent, that kind of evens out.
Right.
So it's not having a pregnancy at say 19 or 20 is not going to be any more high risk than say at having a pregnancy at 25 or having a pregnancy at 30. Where it would make a difference is the fact that an older woman and her partner will have more capacity, more confidence, more resources to take care of themselves better. Direct link between education and age at marriage, between education and age at first pregnancy. And I personally believe that even if we can push up the average age of marriage just by a few points, a few percentage points, it would definitely impact and improve women's health. I don't have a magic number, and I know even if there was a number, it'd be extremely difficult to enforce it. I do believe that when we talk about equality between men and women, I don't see any reason why we should have two different ages for men and women. We don't have different ages for driving licenses for men and women. There was a very interesting study by the Guttmacher Institute published in the Lancet, which that in India, we had almost 48.1 million pregnancies, of which almost half are unintended. Now, if we prevented those unintended pregnancies, you would have fewer unsafe abortions, which is the third most common cause of maternal death. Contraception is life-saving.